One of the most common things cats get is they get a cat bite. They fight with other cats. They don't play well with others. And they get little disputes. They often bite each other or scratch each other, and a cat bite can be very infective. So they'll get swelling like that. See how swollen that is? Look at this other foot. Let's put them together. I know, sweetie. So this one's more swollen. So the owner said, it's really swollen, I think it's broken. But if your cat puts weight on it, it's not broken. And if your cat's got a swollen leg, it's more than likely an abscess. I wasn't picking my nose, I just had hair on my nose from the cat fur. So I just wanted to make sure. I wouldn't dare pick my nose on camera. But anyway, so you can feel with, yeah, she won't let me do too much. See, she says, don't do that. So, to be careful. But there's crust. You can feel crust, scabs around the area. Sometimes you can, it will show you how you can shave or you can wet down the area. But sometimes you can pick off a crust and a bunch of pus will come out. And you can wash it up with soap and water, put a little Neosporin on it. Sometimes abscesses will heal, especially if it's on a weekend. But always get it checked out by a vet because it might be more serious. It might be into a joint or have a problem. So we're going to give this little kitty, because you saw that he was not real. See, now it's got it in my eye. His cat hair was getting me. So we're going to give him some anesthetic. We're going to use kitty magic, we call it. Dexdomitor, ketamine, torbitrol, and we're gonna give it to him so he'll be temporarily sedated, anesthetized, and then we can show you how we cook that up. We're giving him a shot of kitty magic under the skin and in the muscle, and then we'll wait about 10 minutes. Well, are you feeling it? I think you are. You're drooling, vacant stare. Now, isn't that a nice picture? Look at your little tongue sticking out. Look at, now we have a kitty that's nicely anesthetized. Breathing's good. You can see the chest going up and down. And Michelle's putting a little pulse oximeter on the ears so we can monitor the percentage of oxygen and the heart rate. So you can see when we lift up the foot, there's the abscess, and we're going to put on some gloves, but you can see a nice little red pussy river flows out. So we're going to clean that all up, and that infection, and it doesn't smell very good, that infection makes this foot all swollen. So we'll show what it's like after we clean it up. So we're shaving up. We're going to show you where the abscess is. Right there in the foot. That bit right on the foot, that's terrible. But abscesses are real common in cats. They're the most common things we see. You take off the scab often. If your cat's nice enough to let you peel it off, you can take off the scab and then you can squish, you could push out the pus and clean it up. And here's the abscess, Michelle, what happened?
Well, it looks like possibly the cat got bit and it clamped down like this. Because there's 2 puncture wounds right here. So that's probably indicative, if you think so, doctor, of
I think so.
that mouth. Something bit it, maybe another cat.
Right there. So there's the wound, and then where's the wound underneath?
Right underneath.
Now,
And another puncture right there.
don't play with that kitty anymore.
Michelle, she's our head technician and helps organize everything the best you can at a veterinary hospital, but it's really hard. If your cat has a swollen foot, always check the bottom of it, check the nails if you can, and check the foot and the leg for crusts. Be real careful, cats don't put up with much. And if you have to use anesthetic, or if you have to use restraint, then you would scruff the neck and hold them like the mom would hold a kitten. You have to scruff real hard, and then you can kind of investigate a little bit. Sometimes you can wet the leg down, and then you can see crusts more easily, or use soapy water. Just wash up the leg, see if you see crusts or wounds. You can clean up the wound with soapy water. And if it's real swollen and real painful, you might need antibiotics. But if you wash it up, at least by the time you get the vet the next day, some of the pus will have gone out of it. You can even use hydrogen peroxide on it and some neosporin, which will help get the bacterial infection under control, because when cats get bit, it's a bacterial infection. They have really infectious bacteria. You've heard of cat bites being the most infectious. Well, they're pretty darn infectious. There's really no medication you can give them. You can't give them anti-inflammatories like aspirin, Tylenol, ibuprofen. So you just hot pack it and clean it up and put some hydrogen peroxide and neosporin on it. That's the best you can do. If the leg's really, really, really swollen and wobbles at all, or if it's really, really swollen in a joint, it's really painful, then you might need to consider taking your cat to the emergency room. Anyway, we'll check out my website, Dog Dish Diet. Feed Your Pet to Avoid the Vet has some recipes you can home cook for your cats too. Have a great day.